Hello, this is Module 11, Medicines and Medication Adherence. It'll be divided into two parts. The first part is on medicines and the second part will be on medication adherence. I'd like to begin by acknowledging the traditional custodians on the lands on which we are currently on, listening to this presentation. I'm recording and am on the lands of the Gadigal people of the Eora Nation, and I pay my respects to elders past, present and emerging. As we share our own knowledge, teaching, learning and research practices within our university and other places, may we also pay respect to the knowledge embedded forever within the Aboriginal custodianship of country. Thank you. So the focus of this first half is on medicines. The learning outcomes, by the end of this module, you should be able to know about medicines, describe how medicines can be accessed and stored, identify problems associated with medicines use, and identify safe and appropriate use of medicines. And for the second part, to describe medication adherence and its importance. Furthermore, for the second part, to be able to know the extent and impact of medication non-adherence, explain some ways to detect medication non-adherence and reasons for medication non-adherence, then be able to explain some ways to improve medication adherence in patients, and describe the role of CHNs in supporting patients to adhere to their medications. So let's look at what are medicines. Medicines are used to prevent or treat diseases, as well as to relieve symptoms such as pain or fever. They can come in a variety of different forms, such as tablets or capsules or liquids that are swallowed, as creams or ointments that are applied to the skin, as suppositories or pessaries which are inserted, with suppositories in the rectum and pessaries in the vagina. They can come as inhalers which are breathed into the nose or mouth, and they tend to work mainly in the lungs, as injections. And these can be given under the skin, into the muscle, into the vein. They can also come as eye drops or ointments, specifically for inserting into the eyes, as nasal sprays, specifically for the nose, and as ear drops for the ears. Medicines are also available as patches, which are applied to the skin, and where the medicine moves from the patch through the skin and into the bloodstream. So you can see that medicines are available in a range of forms, and sometimes the same medicine can be available in more than one dose form. Now, medicines have specific strengths, and the strength refers to the amount of the active ingredient, while the dose is the amount of active ingredient that's appropriate for the person to take at any one time. And the dosage is how much of the medicine should be taken, how many times in a day, and for how long. So there's this difference to note around strength, dose, and dosage. So if you think about paracetamol tablets, the strength of a tablet is 500 milligrams. That means within each tablet of paracetamol that you buy over the counter in a pharmacy, there'll be 500 milligrams paracetamol, and the active ingredient is paracetamol. The dose is at any one time, it's recommended that an adult person, would take 2 500 milligram tablets for pain. That's the recommended dose. And if you think about the dosage, which is how much should be taken, how many times, and for how long, well, if you've got pain, you would take 2 500 milligram tablets, and you would take that at intervals of 4 to 6 hours in a 24-hour period. And you might take that for 1 or 2 days if you've got pain, or it might be longer depending on the kind of pain that you have. Now, for every patient, their medicine will have a dosage, which is how much of the medicine should be taken. And that, in most cases, will be similar because of the medicine itself, but it could vary depending on the person. What do you know about medicines? Anyway, information about medicines comes inside medicine packages as the leaflets that are folded and placed inside. For example, with vaccinations, you might see it in the pack. With some inhalers, you'll see it in the pack. It can be printed by the doctor or the pharmacist when your medication's been given to you, when the prescription's been given to you. At the same time, you can also download it from a range of websites such as Health Direct, NPS Medicine Wise website, the Pharmaceutical Benefits Scheme website, the Therapeutic Goods Administration's website, and as well as from the pharmaceutical manufacturer themselves. The key information we need to know about medicines in order to be able to take medicines safely and appropriately is, what is the name? What is that medicine that we're taking? Now, each medicine tends to have two names. One's the active ingredient, which is the actual ingredient that has the effect on the body. So in the case of paracetamol, it was paracetamol. We might have one also that's called ibuprofen, which is another medicine. That's the active ingredient is ibuprofen. Then you can have brand name. A brand name for ibuprofen is Nurofen. Another brand name for ibuprofen could be Advil. Now, brand names are specific to the company that makes that particular drug. So other than name, we also need to know the purpose or the indication, which is what the medicine is used for. So what disease or conditions does it treat or prevent, etc. So what's it used for? What's the purpose? What's the indication? The next thing we need to know is what form does it come in? Is it a tablet? Is it a capsule? Is it a liquid? Is it a patch? And what dose does it come in? So how much of the medicine is there in that tablet, say? And is it appropriate for that person? And then how do we store medicines? So storage is important because we want to make sure that our medicines don't go off because they're stored in under the wrong conditions. Most medicines are stored at cool room temperature, so under 25 degrees, and never directly in the sun because that can heat up and damage medicines. Some medicines have to be stored in the fridge, and that's because they have to be below 4 degrees centigrade. We also need to know about the dosage. So we need to know how much to take. So how many tablets or capsules? How often do we need to take it? Is it twice a day, 3 times a day, every 6 hours? And for how long? We also need to know safety information. So when we should not be taking a medicine because it interacts with other medicines or food, or maybe some of the complementary medicines that are bought over the counter or with alcohol. And sometimes you can't take certain medicines in certain disease conditions. So we have to know about the safety of a medicine. We also need to know about side effects. So what could happen when you're taking this medicine that is not the beneficial effect that we're looking for? And then we also want to know how the medicine is going to work. So what's the benefit from this medicine? How do we know if this medicine is working for us? Lots of information that we need to know. And all of this kind of information about medicines can be obtained from the doctor or the pharmacist, or from written medicine information from the websites we mentioned, or from inside the box. So where can we get medicines? Now, you can get some medicines from supermarkets like Woolies or Coles, and these are medicines that are fairly safe in the quantities that are supplied in the supermarket. And there's some examples are pain relief medications such as paracetamol, or medication for heartburn and indigestion. Other medicines you have to get from the pharmacy. So these are not available in the supermarket, and you can buy them either over the counter, so without a prescription, or by directly asking the pharmacist to supply them. So some of the over-the-counter medication could also be pain relief medication such as paracetamol, but in larger quantities than what you would get in the supermarket. Other examples can be inhalers for allergies or asthma. It can be certain creams or ointments for, say, fungal infections of the skin, and some stronger tablets for pain relief, larger boxes of ibuprofen, for example. The next level of medications are those that you need a prescription for them, and you can get that from a doctor or a specialist. And this is when you collect the script from the doctor and it has to be dispensed within a pharmacy. And you can't buy those over the counter because you need a prescription. So 3 levels. You can buy medicines in supermarket, in the pharmacy, or through a prescription from a doctor. Some medicines can only be prescribed by certain specialists or may be given by the hospital. But in the majority of cases, most medicines can be obtained from a general practitioner. In Australia, medicines are supported through the federal government through the Pharmaceutical Benefits Scheme. So the PBS pays for much of the cost of medications that are prescribed by doctors. Sometimes there'll be some co-payment that you would pay, and sometimes there is no co-payment. And this is a small amount that has to be paid by the person. And if you're a pensioner or a healthcare card holder, then this co-payment is even less. In essence, most medications that are available in Australia are funded through the Pharmaceutical Benefits Scheme. And that keeps the cost of medications low for the Australian population. And if you're a pensioner or a healthcare card holder, then what you actually pay even for those medications is lower than what someone would pay if they're not a pensioner or a healthcare card holder. So this reduces the cost of medication for patients, supporting medication taking. What are some of the problems that people encounter with medicines? Well, one of the biggest issues is around errors with medicines, where the wrong medicine or the wrong dose has been provided, or the person takes the wrong medicine or a wrong dose. And this can lead to illness, hospital admissions, or even deaths. And in fact, many hospital admissions are due to medication errors. So it's important that people know about their medications, the dose, the strength, the dosage, so how to take it, when to take it, how long to take it for, how much to take in order to avoid the kind of issues that can come with medicines. Other problems are side effects. So even if the medicine is the right dose, some people can experience the side effects of a medication. Most medicines may have minor side effects. Some medicines may have more severe side effects, and it's important to know about the side effects before taking the medication so that people are able to identify if a side effect happens or if the symptoms of their medical condition is changing. So be able to distinguish between what are the symptoms of the medical condition they have or the disease that they have, and what are the side effects of the medicines. And that then allows people to identify side effects and be able to report side effects. Otherwise, many patients may not actually know that they're experiencing a side effect. An example might be skin rash, for example. So patients should be educated around the side effects, should be educated around spotting what is a worsening symptom, what's the side effect, and then who to report to. Often the doctor or the pharmacist are where you would report side effects. How can we use medicine safely and appropriately? How can we support people to use their medicine safely and appropriately? Well, the first step in safety is to know about the medicines, to know about the name of the medicine, and to be able to understand which is the active ingredient and which is the brand name, so that people actually don't double up on medications if they're taking more than one brand of the same active ingredient. Say if they're discharged from hospital on one brand of a medication and they've been taking a different brand while in the community, you don't want people to double up on that. So you want people to know the name of their medication and know the difference between the active ingredient and the brand name. You want to know why they're taking the medication. So what's it used for? What will it do for them? How will they know if it's working for them? Then you want them to know how often to use it, how much to use it. So around the dosage. And finally, you want them to know around side effects and what can go wrong, and then how to pick it up and who to talk to about it. You want the medicines that a person has at home to be checked against the list of medicines that they were discharged from in the hospital and what the GP thinks that they're taking. So it's important to match what the GP thinks the patient should be on, what the patient has had changed in the hospital and been discharged with, and what the patient thinks that they are taking. And if there is a problem in terms of the matching, then obviously the GP or the pharmacist has to be contacted, as well as potentially the hospital. Sometimes people miss doses because they think that a medication is not working or it's got side effects. So I need to be able to educate people around the side effects, around how the medicine's working, and then figure out how you can advise them around what to do in terms of missed dose. And that information can come from the doctor, from the pharmacist, and the specific written information about the medication. It's very easy to address issues that patients might have. Say it's around being able to swallow a medicine, or remembering to take medication, or how can they, be reminded of it. So there's many issues that can actually help in ensuring that people know how to take the medicine and what to do if they miss a dose. And obviously, if people do experience side effects, it's essential that they are able to report it. So this ends the first part of this module.